Welcome, my friends, to the Bob and Brad podcast. My name is Mike Kienitz, and I'm a PT assistant. Today, I am interviewing Dr. Abbasi, who is one of the nation's leading spine surgeons. He works for Inspired Spine, based out of Minnesota, but they also have locations other places throughout the country. He specializes in minimally invasive spine surgeries and was one of the most experienced surgeons that performs the OLLIF procedure. He is also the only surgeon currently performing the minimally invasive thoracic interbody fusion. So without further ado, here's Dr. Abbasi. Welcome back to the program, Dr. Abbasi.
It's my pleasure to be with you.
So our first question today is, what is the OLLIF lumbar fusion and what makes someone a good candidate for it?
Well, OLLIF lumbar fusion is a method of making a bad disc go away. The way I describe to my patient, our spine is made of bone and disc, and a disc is like a tire of a car. Obviously, we try to save the discs, and very often we try to help the patient without the surgery. And sometimes, if you have a bad tire, what happens, you go and patch the tire. But now imagine your tire is so old, so bad, that has many holes. It's really no good way to repair that tire. Unfortunately, until now, our standard of care is to get completely rid of that tire. That process is called fusion. In the process of fusion, often what we do is, first of all, the first thing we do is we get to that bad disc. And since the disc is in the middle of our body, sometimes that process itself is extremely invasive and causes a lot of collateral damage. OLLIF, or oblique lateral posterior lumbar interbody fusion, is a method of the surgery that we get to the bad disc with a tube that is barely thicker than a pencil. And by doing it through a smaller hole, it enables us to not cause lots of collateral damage, to get to the bad disc, get the bad disc out. And then in this process, we usually put a spacer in. We call that spacer a cage, which separate two bones against each other, and as such restores the disc or disc base to the way it was supposed to be. This is now practically a method of the surgery that has been developed in the last 12 years. And the advantage of this to the other ways of getting to the disc is exactly that we use a tube that is barely thicker than a pencil and not cause all the collateral damage that other methods produce to get to a disc base. Those other ways is either from the back, where we not figuratively but literally fillet open and cut all the muscles, which then in turn they become scarred. They are not useful muscles anymore. Or go through the belly, through the abdominal cavity, where major vessels, major organs are. You have to go through major vessels and major abdominal organ to get the job done. So by being able to cause the least amount of damage to get to the disc, we get a lot of benefit and benefit for the patient in terms of restoring their anatomy with less damage to surrounding tissue, faster recovery, less blood loss. And that is what OLLIF enables us to do.
So what makes someone a good candidate to have the surgery?
Anybody who has been told that they need a spinal fusion, generally they are good candidates for the OLLIF. Now, in certain situations, if they need a spinal fusion, if the piece of bone pushing on the nerves, sometimes still necessary for us to go there and cut the bone. But beside that, except that somebody has a piece of bone sticking into their spinal canal or where the nerves are traversing, almost all of the other spinal candidates for spinal fusion are good candidates for OLLIF. In most of the cases, that comes to people who have tried all the non-surgical treatment, including physical therapy and injections. And what the problem is cannot be just eliminated by just trimming the disc.
Sure. So what things do you try with patients before performing a lumbar fusion surgery?
Practically everything. Now, generally, a disc is like a tire of a car, but it's a living tissue. And our body is generally a self-healing machine. Our body, our tissue, our discs are living things. And every process in our body is a race between healing process and wear and tear. Many times when the wear and tear go ahead of the healing process is when we have symptoms in our musculoskeletal symptoms. And we have musculoskeletal symptoms. Now, our job as surgeons is first maximize non-surgical methods to help the patient. And many of them include protecting the tissue so they can heal better. Like the way I describe it to my patient, if you have a wound in your hand and you poke in it, it's just not going to heal. There are ways to put your spine in a situation that is most suitable for its healing. Obviously, imagine you break your arm, you put it in a brace, or you put it in a sling, you don't use it. There is really no situation you don't use your spine. That's unfortunate because it has to heal under continuous use. But there are ways to support it, like we give you a list of things not to do. We send the patient to physical therapy to build up muscle around the spine. For those activities that are demanding or you cannot avoid, we put you in a brace. As well, we do injections. We put you in a situation that your body, your disc, your tissue around the spine get a shot of steroid. Steroid is a hormone your body produces when it's trying to heal things. We give it artificially to those areas, and by doing that, we put the spine in the most suitable situation to heal. Unfortunately, for many patients, all of that is not enough. That is when the surgery becomes the next option.
All right. Where can people go to find more information about you and your clinics and where they can sign up to meet you?
Well, it's actually, if you just put these 5 letters, OLLIF, double L, you will see that 90% of the material in the internet is what we put out there. They have published paper. And if people go to YouTube and put like OLLIF, you will have 1,200 testimonial of patients who have been treated. And I pick the average of everything, like literally you can sit in front of the YouTube and go hours down, scroll down, and you see our patient. Put your condition like OLLIF spondylolisthesis or OLLIF elderly, OLLIF spondylolisthesis. You get more testimonials, informational material regarding that. Or they can go to inspiredspine.org or inspiredspine.com, and they get all information regarding us. We get, in average, about a dozen of patients every week from other states that we go online. And long before people knew about the Zoom and before COVID, we have been having this Zoom and internet consultation helping patients all across the US and even world.
So where